medicine. Okay, that's an anti-tumor antibiotic. So that one you'll come across. So when you hear antibiotic, what do you think?
Infection.
Antibiotic.
Oh, antibiotic. I thought you said antibiotic.
Yes, think meiosis, it's part of cell division, right? So this drug that I'm going to tell you is an antibiotic. And this one here is vincristine. Okay, that's a common one. This one, lucky for your patient, does not have all of that. So it's a little bit better for your patient. It doesn't impact, it doesn't cause myelosuppression, it doesn't cause a lot of that stuff. So that's one that you might come across. And again, when we're talking about cancer therapies, you're going to kind of sort of look at it, right? And I know sometimes patients get frustrated because they're like, I was just on a particular drug, why am I on a different one? A lot of times these drugs will stop working, so you need to try something different, right? There's more than one way to skin a cat, right? There's lots of different drugs we can use, there's lots of different ways we can attack these cells. So, explain to them that last one may not have been working, or it may not have been working well enough, or they were experiencing myelosuppression that was too much, so we have to try something different. That's one of the beauties of medical science is it's all an experiment, right? Each person is different, bodies are different, the way their body reacts is different, and so you can't have like a one size fits all for every person. And so we try different things. Sometimes patients get a little frustrated because, rightly so, they have cancer, for example, and they want it done, they want it fixed. That's understandable, and that's what we're trying to do. So some of that comes with educating your patient. So antibiotic, so vincristine, that's one that you guys will come across pretty frequently. So, chemotherapy, radiation, surgery, those are some of the biggies when it comes to cancer treatment, right? Now, I talked about immunomodulators, or biologic response drugs. We talked a little bit about that when we were talking about RA too, right? So let's do biological response drugs. Okay, over in that section. What does that sound like? Think about your immune system. Think about what goes on. What are we doing with it? Biological response. Throw anything out. It's okay.
Cells for changing the cell.
So, think of your immune system, right? When we're talking about biological response drugs, we are fiddling with stuff, right? We are telling your body to do something. These types of drugs will either, what you can call, regulate up your immune system, or you can regulate them down. So up modulate or down modulate, those are different terms that you guys will hear, means the same thing, right? You're increasing your immune system, potentially, or you're down regulating, or you're decreasing, or you're suppressing your immune system, right? So there's different situations when you're going to want to do one or the other, right? So when we're talking about immune system, when you're upregulating your immune system, what are we doing? What does that sound like?
We're protecting it. Maybe like when you get antibiotics and then you give probiotics.
Okay, it's a pretty good example. You're trying to help it out,
Yeah.
right? So you're not necessarily, I guess you are protecting it. What you're doing is you're giving medications to bolster your immune system, right? So you give some of the drugs in that monoclonal antibody drug class are immune modulators. And they'll modulate your immune system up. It helps it. Think about when you have patients, chemotherapy. A lot of times you're gonna have multiple therapies going on at the same time. You're gonna have chemo to try to kill cells. You're gonna give one of the monoclonal antibodies or one of the other upregulating immune drugs to counterbalance white blood cells that are too low, right? You're helping stimulate, you're helping modulate it up. We can give medication, so there's also hemopoietic medications that we can give. Remember that? Hemopoietic. What is hemopoietic? We talked about one in particular already, related to red blood cells, remember? Anybody? Epogen or erythropoietin, spelled that wrong, but okay, that's a hemopoietic drug. That's a drug that actually helps increase the number of red blood cells, right? There's drugs that help increase white blood cells, like colony stimulating factor drugs, like filgrastim. Okay, filgrastim. So beneath those in with that grim, that grastim ending is a colony stimulating hemopoietic drug.
Is it what?
Colony stimulating. So that means it's going to help blood. Opreldikin is another one of these. Not one of those, but it's in the hemopoietic. Opreldikin, I think that's what it is. That one helps stimulate platelets. Okay? So you're going to have combo therapies going on. Because you're destroying these with chemotherapy potentially. But you're going to help it by giving one of these others that also helps with some of those dose limiting effects. Right? Again, when we're talking about cancer, we're talking pros and cons and cost benefit analysis. And I know that sounds kind of callous, but there's a cost in taking chemotherapy, right, to your body. See those on a little video that I'm going to show you guys. But those are some hemopoietic drugs. So immune system, these, under the biological response, these are your MABs, right? You have these medications that end in MAB, monoclonal antibody, they will either do one of these things, right? So, some of these drugs are also for tumors. I told you guys, like the MAB, what it does is it uses your immune system to help fight things, right? And our immune system is pretty freaking amazing. It really is. I think I was telling you guys about the one that we have patients that have high cholesterol. And again, it depends on what you're doing, because you can do both. You can upregulate your immune system, you can help it out, or you can downregulate.
So what you see when you're downregulating with somebody who can perform that?
Okay, so what I did here, so tissue necrosis factor inhibitor. Remember when we talked about that relative to rheumatoid arthritis? That's one of those medications you can get for rheumatoid arthritis. You give them for diabetes. Okay, interferon. That's another one. That's another biological response. But here, there's also cytotoxic antibiotics that need to be used.